Africa now has over 1 billion inhabitants, 56% of whom are under 30 years of age. To tap on this young population, countries must invest in job creation, good governance, infrastructure, and good business climate. However, progress in these areas will be limited if people are not prepared. If young people, especially girls, do not access to education and health and do not take advantage of their rights.
Look at 10, 20 years. When we look at such age brackets, it means that they are those who are coming to take over. Maybe for some of us, will be gone. But if you've put in place proper investment for them, it means that even for older people, they will benefit from the investment that went into younger people because they are now very competent. They won't be the criminals we'll be afraid of. At least bringing up the issues to bear so that in an issue like HIV, you won't say that, oh, we are improving, and yet the numbers of young people is rising. It is not very good for our continent. Africa is also talking about Agenda 2063. And if we are talking about Agenda 2063, anytime we want to review within 10 years, we are looking at a young population that has aged 10. So if the person is 10, at that time, that person is 20. The next time around, they are 30. How are we going to cater for them? It means addressing their sexuality issues. Anytime we don't address sexuality issues very well, it means that we have abandoned our population to grow out of control. Even when you are having a party, you ask how many people are coming. You know how many you are going to cook for and the provisions you are making. But if our population grow out of proportion and we don't even know the numbers, they become vulnerable because you cannot adequately cater for them. So serious population issues, demographic issues will come up to be mentioned, discussed, and then the follow-up processes will continue.
For many countries, the first step towards the achievement of Sustainable Development Goals for 2030 is the demographic dividend, an increase in economic growth that occurs in a country where the number of people of working age exceeds that of dependents such as children and the elderly. With declining fertility rates and a good share of their populations soon to be in a working age, many African countries are in a position to benefit from the demographic dividend.
The ICPD agenda, developed over 2 decades ago in Cairo, continues to guide our work at UNFPA. It reinforces the importance of investing in people, particularly women and girls, investing in their health, particularly their sexual and reproductive health, in their capacities and capabilities, and in expanding their opportunities to realize their full potential and to achieve sustainable development. There is no better investment in the world than the health of our people. And the demographic dividend speaks to that. Now, for otherwise healthy young people, the greatest need is to offer them sexual and reproductive health care and preventive services needed to avoid unwanted pregnancies, sexually transmitted diseases, HIV, or if pregnant, the terrifying spectacle of an illegal abortion or delivering their babies without medical care.
It is in this context that was recently held in Accra, the capital of Ghana, the African Conference on Sexual and Reproductive Health Rights under the topic Achieving the Demographic Dividend in Africa, the Critical Importance of Sexual and Reproductive Health Rights of Adolescents and the Youth.
Meetings like this one are important in order to compare notes and share best practices. And that's why this biennial meeting on sexual and health rights is important, because it allows us to assess how far we've come, what we're doing, and then see what each other are doing in our countries so that we're able to learn from each other and be able to implement the most effective issues.
Chaired by the President of Ghana, John Dramani Mahama, the conference, now in its 7th edition, saw the participation of Dr. Lordina Mahama, Ghana's First Lady and President of the Organization of African First Ladies Against HIV/AIDS. In the presence of the First Ladies of Mali, Ivory Coast, Sierra Leone, Kenya, Ethiopia, and Guinea-Bissau, Mrs. Mahama has launched the all-included continental campaign to end the HIV epidemic among adolescents. 74% of new infections are in fact girls aged 15 to 24.
The Global All-Included campaign seeks to intensify the efforts to prevent new HIV infections and avoid new deaths in an environment of stigmatization and discrimination. This results into the need to involve young men in new HIV programming. There were some progress in HIV response, but the youth was left behind. To address these issues, the All-Included campaign focuses on 4 points: involve, mobilize, and empower the youth as leaders and actors of social change, encourage innovative approaches to reach adolescents for access to essential HIV services, adapted to their needs, involve families of HIV-infected people to conduct concrete actions, and mobilize resources.
This conference, which is held every 2 years, wants to make 2016 a year to accelerate progress on the African continent with a special focus on health. It is part of a long-term process to build and maintain a regional dialogue on sexual and reproductive health and rights in this area. The goal is to educate young people, civil society, but also the media through workshops and discussions on AIDS, child marriage, early pregnancy, or female genital mutilation.
Everybody is bringing out with a very good idea. Yesterday's session, for example, was perfect. Young people had to be brought together. Young people had to feel that, oh, this is my parent. I can share something about sexuality with my parent. Because you see, one problem with Africans is that when you're growing up, they don't teach us. They don't talk about sex to us. So when we grow up, we wanted to know exactly what is it, and that makes us do a lot of mistakes. Now, we've learned that when my child is 12 years or 11 years, I can tell you, hey, you're growing up, and when you do this, you do this, you do that, this the results you're going to achieve with regards to that specific topic.
For the last 10 years or so, the general approach to sexual reproductive health has always focused on larger things, and the individual was not really taken into account. That people are very different, each individual is very different, and women are different than boys. But I think one of the most key things I've seen at this conference has been the challenge to end child marriage, because it is one of the key things, and it's very crucial, because as the president was saying, if a girl is not allowed to go to school, if a girl is not allowed to make her own choices, and if she's married off at 11, at 15 or whatever, the life she has ahead of her is cut very short.
This awareness and this display is not only to use a condom, but to also help in family planning. And this goes a long way to help in the democratic dividend, because people keep going. If you don't know how to protect yourself, if you don't know how to space your children, then you're actually increasing the population. So in effect, it's not just towards prevention of STIs, including HIV, but in the long run, if you are using a condom, then you wouldn't have unwanted pregnancies. You're helping in one way. If you're using a condom, you know that you have to space your children. So you're not just having sex to produce children, but you're having sex for pleasure. At the same time, you're preventing unwanted pregnancy. So I think in the long run, people will think that, okay, you just want to promote people to have sex. But it goes a long way to help a lot of things.
Beyond awareness raising, the 7th African Conference on Sexual and Reproductive Health Rights was also the starting point of a campaign against child marriage to fix 18 as the minimum age of marriage, a priority for girls to have the freedom to decide when and whom to marry, to plan their pregnancy, and have security to combine work and family life. 40% of girls in Africa are married before their 18th birthday.
L'Afrique est en fait le continent où on a le plus.
Africa is the continent where we have the most child marriages, not only child marriages, but also forced marriages. When we talk about child marriages, it is also about less than 18 years old, according to the definition of the UN of what a child is. Ghana has just joined 10 other countries committed to putting an end to this phenomenon in Africa. Niger, DRC, Chad, Madagascar, Zambia have just launched campaigns in this regard.
Le Madagascar, la Zambie.
For UNFPA, which is a major player in creating the conditions necessary to the realization of the demographic dividend, the conference marks the beginning of a continental dynamics driven by significant investment for young people and especially girls to get them to participate in the economic development of their country.
L'Union africaine vient de prendre la décision, il y a de cela quelques jours.
African Union took the decision a few days ago that the 2017 summit will take about the demographic dividend. I think that this is an important milestone set by the heads of state. As people say, the decision is taken. We have to do with it. We have other gains. For instance, if you look at Agenda 2030, the issue of the demographic dividend is at its very heart. Look at Agenda 2063. The issue of demographic dividend occupies a key position. So we are talking a little bit about the interconnection between policy documents. Here, we are at the global level. In Africa, we are right in Agenda 2063. At a more detailed level, we get in the practical field, and the heads of state are saying, listen, we do not want to limit ourselves to 2030. We say that it is our priority in Africa, but in our program of 2017, we want to push the agenda as far as we can. The process is well underway, and I think that this is a recognition by the heads of state that the future of Africa rests in the demographic dividend.
Le dividende démographique.
The 8th edition of the African Conference on Sexual and Reproductive Health Rights is to be held in 2018 in South Africa under the theme of the relationship between the rights of sexual health, education, and innovation. For the conveners, the objective will be to find new ways to apply new technologies to promote sexual and reproductive health rights.